Tracheostomy, while often life-saving, comes with a variety of complications that can occur at different stages, immediately post-operation, in the early post-operative period, and in the long term. Today, we'll explore these potential complications, emphasizing both their causes and how we manage them. One of the most common issues is tube obstruction, where mucus or blood clots block the tube. Routine suctioning and humidification can help reduce the risk, but healthcare teams must be vigilant, as obstructions can lead to respiratory distress. Accidental decannulation can happen if the tube becomes dislodged, especially early on when the tract isn't mature. Replacing the tube immediately is crucial, as the opening may close or cause a false passage. General risks from surgery or anesthesia include bleeding, infection, and very rarely, death. These underline the importance of considering risks versus benefits for each patient. In the early postoperative period, within 1 week, bleeding around the wound edges is common, and it can be controlled with pressure or suturing if necessary. During the procedure, air can enter the pleural space, leading to a collapsed lung, known as pneumothorax. This can be managed with chest tube insertion, if severe. Air can sometimes get trapped under the skin around the tracheostomy site, causing swelling, a condition called subcutaneous emphysema. Though usually harmless, severe cases may indicate improper tube placement. Given the open nature of the tracheostomy site, it's at risk for infection. Strict hygiene and antibiotic coverage, when necessary, are crucial preventive steps. Temporary cessation of breathing, or apnea, may occur due to sedation effects. Continuous monitoring ensures rapid intervention if needed. In the late postoperative period, after 1 week, granulation tissue can develop around the tracheostomy site due to the tube acting as a foreign body. This tissue can obstruct the airway or bleed. Dr. Sharma emphasizes using topical steroid/antibiotic preparations to control it, and in severe cases, bipolar diathermy to remove the tissue. Over time, some patients may experience bleeding and suprastomal collapse, especially if the tube is left in place for an extended period. This may require surgical intervention to correct. Constant contact with the tube can lead to skin complications such as pressure sores or infections. Regular inspection and repositioning help prevent these issues. Tracheostomies can impact speech, leading to feelings of isolation or frustration, especially for long-term patients. Rehabilitation and counseling play key roles in addressing these challenges. A rare but severe complication is tracheoinnominate artery fistula, which is a life-threatening condition where the tube erodes into the nearby innominate artery. Dr. Sharma highlights this risk, particularly in patients with abnormal anatomy where the artery lies higher than usual. Immediate surgical intervention is often required, but prevention involves ensuring the tube is neither too high nor too low in the neck. The risks associated with tracheostomy are diverse and can occur at any stage post-operation. Understanding these complications allows healthcare teams to take preventative measures and intervene quickly if issues arise. Dr. Sharma's ENT lectures emphasize the importance of individualized patient monitoring, regular follow-ups, and using the latest techniques to reduce risks wherever possible.